It's been a remarkable few days in South Korea as the number of daily COVID-19 infections has more than doubled since the start of the week, passing 621,000 at its highest peak so far, meaning more than 1% of the country being infected in a single day. And even after a significant drop with today's latest update, we still saw more than 400,000 new cases in 24 hours. Thankfully, most of those infections are mild, but that doesn't mean we're not feeling the impact, including at funeral halls like this one at Seoul-National-University-Hospital. A worker here told us the mortuary at this facility can hold up to 18 sets of remains at a time, but is currently full and cannot accept new remains. It's a similar story elsewhere, with the head of the Korea Funeral Association offering the grim assessment that the situation's more than serious, with dead bodies piling up. At this point, we should also explain that in Korea, funerals are typically held over 3 days, with family, friends, and acquaintances visiting funeral halls during that period before the body is cremated on the third day after death. But because crematoria are finding it hard to cope with backlogs due to the spike in COVID-19 deaths, families are now having to wait up to 6 days to have their loved ones cremated. The situation's particularly strained here in Seoul, but it is a nationwide problem. According to official data, more than 94% of families who lost a relative from March 1st to 13th were unable to stick to the traditional 3-day funeral period. Nationwide, over 60% of families faced the same wait, and crematoria in Seoul have been fully booked this week, forcing people to go on a waiting list. For some families, they've gone to the countryside to hold funerals instead. Others have waited it out, but then you've got that issue of bodies piling up. Because there aren't enough mortuary freezers available everywhere, you can imagine the challenge for funeral facilities. The COVID-19 fatality rate in this country remains relatively low at just over 0.1%, but it's the sheer weight of cases that's causing the problem. According to a funeral hall official at Seoul-National-University-Hospital, between 30 and 40% of those who died recently passed away due to COVID-19. If you look at South Korea's daily COVID-19 deaths, they have shot up this month, staying above 200 for 6 days until this past Tuesday, then briefly dropping before soaring past 400 and staying over 300 based on the latest day's count. That's being felt in Seoul particularly because the city was already lacking in crematoria, partly because residents don't want them near where they live. So an existing shortage has become even more serious because of the pandemic, also because funeral hall staff get infected and have to miss work just like everyone else. Amid calls for crematoria in areas surrounding the capital to help resolve this grisly crisis, they have increased operating hours by up to 5 hours a day, but apparently that's still been insufficient. This is obviously an immediate problem to be solved, but experts also warn it's a long-term issue in a society with a fast aging population.